Well, thanks for inviting me to talk to you about the political foundations of redistribution. Um, so we've discussed policies of child poverty reduction, the economics of poverty reduction in general, and specific policies to reduce inequalities in health. I sense a strong feeling of wanting more redistribution towards poor children in this room. But then we need to ask ourselves, what are the political foundations of redistribution? How do we sustain willingness to pay for redistribution, and which policy should we choose to prioritize? And so in this presentation, so I'm a political scientist, and I do political economy of public finance. And I want to present some of my previous work and some of the things I learned from the literature to help you think about how should we try to sustain this redistribution that most of you want. And so I'm sorry, I'm not going to talk so much about children today. So I'm going to start by talking about these four levers of redistribution: tax progressivity, tax level, benefit level, and benefit progressivity. And then we're going to think about how to spend the money. We're going to talk about the logic of universalism and whether it is possible to target the poor within universalism. And then we're going to think about how to get the money, talking about tax levels and tax progressivity. So redistribution and poverty reduction are very strongly related. Usually countries that redistribute the most also achieve higher levels of poverty reduction. And we can think of redistribution as simply the difference between the inequality achieved by the market before the government intervenes and the disposable inequality, which is the inequality after the government intervenes. And so I'm really interested today in talking about this difference between the two. Not talking about the inequality generated by the market. This is another field of research. Here you can see differences between countries. In market inequality, let's take Canada here, as relatively low market inequality, but doesn't do so much redistribution. The difference between this line and this line is not so big. If you compare to, for example, to Ireland, which has very high market inequality, but a quite generous welfare state, actually, that reduces inequality quite a bit. And so what is redistribution? Redistribution is a function of four things. Okay, so it's the transfer rate, so the level of transfers that are achieved, the progressivity of transfers or the targeting of transfers, whether these transfers are given to the poor or to the rich. So this is a multiplication of the transfer rate and the progressivity, plus a multiplication of the tax rate and the progressivity of taxes. So these are four elements. And so you can play with one of these four elements to increase or reduce redistribution. And just as a side note, this redistribution in terms of benefits is generally actually excluding services. For example, healthcare. Healthcare is a service, but it's quite hard to measure actually the incidence of healthcare services, although it's probably quite progressive. And so these measures of redistribution are a gross underestimation of actually what governments are able to do with the redistribution, because they don't include services. They focus on cash benefits because this is easier to measure. So obviously these four components of redistribution are related. For example, a government cannot achieve high levels of spending without high levels of taxes. This is quite self-evident. But there are functional and political trade-offs between these components. So you cannot achieve the four components at the same time. And then many researchers have been interested in thinking about the effect of the size of benefit or of taxation and the progressivity. And the consensus that I want to talk about today, that is a bit counterintuitive, is that size of benefits and of taxes matters significantly more than progressivity if we want to redistribute. Countries that redistribute the most tend to maintain high levels of taxes and high levels of benefits, but not progressive taxes or targeted benefits. Why? Well, the conventional wisdom would say that basically for each dollar you spend on social spending and social benefits, making sure that the poor receive more than the rich is the most efficient way to redistribute income. And therefore, many organizations or pundits will consider that universal programs are a waste of money, because when you're doing universal programs, you're also giving money to the rich. And therefore, redistribution should focus only towards the poor. That's the conventional wisdom. But what we know is that the transfer rate, basically the size of benefits or public social expenditure, has significantly more impact on inequality than the degree of targeting of the benefits. So here I have a measure of the size of benefit and a measure of redistribution. You clearly see that the countries that achieve more redistribution have more social spending, a bigger size of benefit. And here I have a measure of the progressivity of benefit, where 0 means basically that your benefits are proportional. The rich and the poor receive similar amounts of benefits. And a negative score here means that the benefits are targeted towards the poor, with Australia being the most targeted country. But you don't see a relationship between the targeting of a country and the degree of redistribution it achieves. And if you do proper regression, actually, you'll find the same. You'll not find an effect. You'll find that the transfer rate has much more effect on redistribution than the targeting of benefits. And when you think about it, it makes sense. Let's say that you have a country, you tax everyone at 40%. Everyone pays 30% of their income in taxes. And then you take all this money and you divide it so that everyone receives the same amount of money based on that total 30%. Well, the rich will pay much more to fund that money, and the poor will receive a significantly larger proportion of their income with that money. And you would probably achieve more redistribution in such a large state situation than if you would tax the rich and not the poor, but you would not achieve a very high level of taxes, for example. And so what we know is that countries achieve more redistribution and reduce poverty the most with universal benefits more than with targeting the poor. And so therefore, there would be some form of a trade-off between the size and the progressivity of benefits, as more progressive benefits reduce the size of benefits. So targeting the poor would actually lead to poorer programs, less generous programs. And therefore, if you have a smaller total budget, you will achieve less redistribution. And so thinking of redistribution in a way of a Robin Hood logic, taking from the rich to give to the poor, is probably less efficient than a broad egalitarian provision of services and transfer. So a country achieves more redistribution when it takes from all to give to all than when it takes from the rich to give to the poor, which is kind of counterintuitive. Why is it the case? Well, it's about politics, basically, because citizens are significantly more likely to be willing to sustain redistribution with their own taxes if they see themselves also as potential beneficiaries of the state. So liberal welfare states, smaller welfare states like Canada, Australia, the US, tend to offer a limited social protection to the middle class. So therefore, the middle class needs to rely on some form of private alternatives to receive social protections. For example, private healthcare, private pensions. And because in these welfare states, the benefits are targeted mainly on the poor. They are means tested towards the poor. The poor receive the benefits. The middle class receives fewer benefits. And therefore, the middle class uses private social insurance. And when you're a user of private social insurance, generally, you're less likely to support the public provision of social insurance. And by contrast, in more universal welfare state, as we find in Western Europe, the public insurance program will offer good replacement rates for the middle class, meaning that, for example, if they lose their income and go on unemployment, they will receive relatively generous replacement rate from the public insurance. Or when they take their retirement, they will receive relatively generous public insurance as well. And therefore, the middle class in these universal welfare state is more likely to sustain redistribution. And therefore, the idea is that the welfare state that target the poor cannot bring the middle class on board to sustain redistribution. So that's the kind of the political trade-off. If you just target the poor, you don't get the middle class support for the welfare state, and this is the problem politically. And as Amartya Sen said, programs for the poor are poor programs. If you're just targeting the poor, you're not going to get generous programs. And there's also this idea of stigmatization with programs that are means tested toward the poor. Many presenters talked about that before. But there's, when you target programs to the poor, there's some form of zero-sum conflict between low-income households that receive the benefits and the middle-class citizens that pay for the benefits. And it discourages broad coalitions in support of the welfare state between the poor and the middle class. And also this targeting, this means-tested testing will foster public discussion of the worthiness, the neediness, and the deservingness of beneficiaries, discussion that have also been amalgamated with race in the US. And even among beneficiaries, means testing creates a negative experience. And therefore, it's, in general, when you have a means-tested welfare state, you tend to have lower public preferences for redistribution. And there are many studies that look at the effect of targeting on public opinion. In general, a more targeted welfare state reduces support for redistribution of income. It also increases polarization between the rich and the poor, in the sense that the rich are significantly less likely to support redistribution if they are very unlikely to receive benefits, which makes total sense. It generally reduces support for taxation. People are less likely to be willing to pay for the welfare state if the welfare state targets the poor only. And my research have shown that when you have a more targeted welfare state, these policies, the targeted policies, are less resilient to austerity measures. They are more likely to be cut back when a government implements austerity measures. To give you an example related to child, I think the Quebec strategy of implementing universal childcare actually really worked. And there were debates during when the program was implemented between some people that were saying we should actually target the program towards the poor. And as we discussed, I think a lot in that conference, one of the objectives of the program is to help to reduce inequalities between children of families of low socioeconomic backgrounds and those of high socioeconomic backgrounds. The problem now is that our program is not actually universal. It's really pro-rich in the sense of like you have more childcare spaces in rich neighborhoods, but technically the program was designed to be universal. And I would contend that this is one of the reasons why this program has been long-lasting. If we targeted that program to the poor, the government that implemented that program in '97 lost the election in 2003 against a party that actually wanted to cut back the welfare state. If the program would have been only targeted to the poor, it's very likely that this new, more right-wing new government would have cut back the program. But now, since the program benefits the middle class, it's very politically difficult to attack that program and to retrench it. And so I think it was politically efficient to create this program that is potentially economically inefficient in the sense of like you could just target poorer children. That would be good. But you would probably end up with a much poorer program. And actually that's what we saw in British Columbia. In 2001, actually, the NDP, which is a social democratic party, expanded childcare for the poor. At the end of the mandate, lost the election, program was cut. Same thing happened in Ontario in 2018 when the Liberals, which had a quite progressive leader, implemented the childcare program, lost the government, and the Conservative could cut back the program. In both these cases, the program was not universal. And the federal childcare program that has been implemented in 2022 in Canada is more universal. I think they actually got the lesson. But the problem is that probably that the parents will not see a change before the change of government. And the program is not particularly generous, the federal program. It's not going to be able to reach Quebec levels of generosity. So maybe the logic of universalism will not have the time to play out, and the next Conservative government may be able to cut back that program. Moving on. So how do you make sure that you're targeting the poor within universalism? So here we created an index of universalism, more universal countries, more residual welfare states. Our index is basically whether your country uses means-tested benefits and a lot of private social insurance, meaning that you're more residual. And this pro-rich, pro-poor dimension is pro-rich means that the rich receive higher levels of benefits than the poor, and pro-poor means the poor receive more benefits than the rich. And so some countries, which is basically Scandinavian countries, Belgium and New Zealand, are able to achieve relative universalism and pro-poorness, which is kind of a puzzle. Like, how does it work? If you're not means testing, how can you actually target the poor without means testing? Well, so what we found, basically, I'm going to tell you in a nutshell because I want to move forward, is that you need to target working age adults that lose their job. That's pro-poor universalism. If everybody can receive unemployment benefits, you will achieve these pro-poor and universal outcomes. Because like unemployment benefits, if you have basically a coverage rate of 100% of the unemployed, it's a universal program. It's just that the people that receive it are poor, right? And you can think about a lot of programs like that. Let's say you do a programs for single mothers. Well, the beneficiaries are generally poorer than average. So if all single mothers receive benefits, well, it's a pro-poor universal program. And then targeting within universalism can also be achieved with policies that offer more benefits to the poor than to the rich, but still give benefits to all. And the Canada Child Benefit that was created by the Liberals in around 2017, 2018, fits in this category. It gives significantly more money to poor households, but gives a bit of money to rich households. And one of my friends who's really quite rich really likes that program because he receives like $12. And then he's like, I'm like, oh, dude, you know that like you don't really receive money in contrast to the others. He's like, yeah, I don't care, but I still receive something and I can go give ice cream to my daughter and I'm happy about it. Right? So it's important that he did receive his $12. Although like some parents will receive like $9,000, right? But he receives his $12. He's happy. So tax levels, I need to go faster. So because high levels of social benefits matters the most for redistribution and poverty reduction, sustaining citizens' willingness to pay to maintain levels of taxation is crucial. And some factors are associated with willingness to pay. So you need to have trust in government, perceive that the public services are of quality, which is a big problem right now because nobody has trust and nobody perceives that services are of quality. More educated people are generally more likely to be willing to pay. Left-wing people are also more likely to be willing to pay. And contributory funding is a good strategy. Contributory funding is the idea, for example, you pay for public retirement via a social security contribution that only goes towards public retirement. This is very good because people are under the impression that they pay for their own thing, which is not true, but they still think they pay for their own thing, so they like it. And so these contributory funding mechanisms are very good for willingness to pay. They are economically not super efficient, but they are politically extremely efficient. And my new research suggests that becoming richer makes you more willing to pay, and that becoming poorer makes you less willing to pay, which is a problem. So income decline is a problem. So growth is good for taxation. I want to go a bit, I'm finishing with this. So large welfare states are generally funded by social security contributions, so a lot of contributory programs, a lot of value-added taxes. These are not very progressive taxes. And so you see basically that there is a very clear relationship between levels of taxes and inequality, and actually an inverse relationship between tax progressivity and levels of taxes, basically because countries that maintain high levels of taxes need to use non-progressive tax instruments. No country just tax the rich to maintain high levels of taxes. It doesn't exist. It doesn't really work. I cannot really go into the details, but we can discuss it in the Q&A, because there is a trade-off between the progressivity of taxes and the average tax rate. And so there's a trade-off there. So two trade-offs: progressivity of benefits and levels of benefits, and progressive taxes and levels of taxes. So I conclude on this, well, two slides. There is very strong public support for taxing the rich. Okay, so technically, if you were just following public opinion, you could just tax the rich. And it's basically because of self-interest. Nobody perceived themselves to be rich. And then they realize, oh shit, I'm actually rich when the tax rates are increased. But so taxes on the rich are very popular. They are also popular among people that perceive that the market distribution is unfair. But the problem is that preferences stated in surveys about taxing the rich may not actually resist a political debate that will be marked by collective action problems, in the sense of when you tax few voters, they will organize, they will fight back, and they will say that this is bad for the rest of the country and for the economy and whatever. Whereas like the rest of the taxpayer that benefit from that increase of taxing the rich are not organized. You know, it's a collective action problem. You don't have organization that defend like the average taxpayer or the average consumer. But the rich that are targeted by the tax increase will fight back and probably will win. And also the problem is also that just taxing just the rich, taxing capital, corporation, doesn't generate so much revenues. It's fun, I mean, because it's fair, but it's a lot of wasting of political capital for not so much actual revenues. And since revenues are what matters the most, you know, trade-off. So key takeaways. Where's my last slide? Hey. Bon. A sustainable child poverty reduction strategy should not forget the logic of universalism and the paradox of redistribution. So it involves to accept some degree of economic inefficiency to achieve political efficiency. And the importance of the size of taxation and sustaining willingness to pay to sustain generous social benefits and universal services. That's what I think you should get from that presentation. But because increasing the size of the state is hard, because people don't want to pay more taxes, it's important to think about how to prioritize between policy fields and thinking about the logic of targeting within universalism, making sure that people who lose their job are actually well treated. And this current perception of the crisis of public service, lack of trust, and rise of populism is not good news for willingness to pay, and therefore for redistribution. And taxing the rich is not a simple solution to fund the welfare state. Thank you.
Thanks, Olivier. You really challenged us with some of these ideas, which is very, very important. And you know, I think, but what you've done is to identify some of the areas where those of us who argue for redistribution are going wrong or are misguided in what we think that this might achieve. Questions?
Yes, as we go to that, you also got some applause from people who are online.
Oh, good. Oh, some questions or applause? Oh, good.
Hello, I'm Ashley. I'm from Melbourne Uni. Thanks so much for that talk. It was very eye-opening. As someone who doesn't know much about the world of political science, I would love to clarify about sliding scales of benefits or taxes and if they are part of universalism or part of targeting and where you see their place.
Do you mean means tested?
Yes, yeah, means tested.
Means tested benefits.
By means tested benefits are means tested and they are not universal. But the idea, technically, if you imagine if by sliding scale you meant like, so the poor receive $8,000, the middle class receive 5, and the rich receive 3, then it, you know, definitions can change. But for me, that's targeting within universalism because everybody receives something. The means testing is really that by social assistance, for example, is almost everywhere means tested. It's like, well, you need to have no assets, no job, and you cannot work, and then you will receive a benefit. This is means testing, for example. And that will create these discussions about the worthiness and the deservingness of the beneficiary.
I have a question.
Oh, yeah.
Yes, thank you for that lovely presentation. We heard this morning questions about how should we go about presenting our data and so on. And you've made a really strong case for how we design the social policies and so on, but you mentioned public opinion and preferences and so on. And so I understand that the design matters, but you also led to some idea about communication. Can you give us some do's and don'ts in terms of mobilizing public opinion, or even point to some research direction so that we can have this kind of influence?
It's a hard question. I'm not a communication specialist, though, really.
Didn't mean to stump you. It's,
Yeah, well-
it's a question we all have. What can we do when we share our results, for example? How should we go about sharing our results in such a way that it's going to mobilize people to get on board, because we think that they're going to have a positive impact, as opposed to going in a direction that it creates polarization and dissent?
But I think that the idea of framing policies as it benefits everyone, I think it's good. Even though if you're doing a policy that benefits children, you're going to help women, you're going to help minorities, you're going to help poor children more than you're going to help like middle-class children, for sure. So I think framing it as it helps everyone, I think is very good. Thinking about who people perceive the beneficiaries to be may be useful also. If it's a very stigmatized group that you're actually targeting, maybe just say that you're actually helping everyone. But in fact, like if you're doing universal policies, you're helping the poor more than the rich, and then you're doing your objectives. But you tolerate that some rich people will receive benefits as well, and I think that's fine. It's kind of a tolerance that we need to have to make sure that we have generous benefits.
But no more than $12. Thanks.
Okay. I mean, I think that the other thing is that certainly in the UK, the Conservative government actually, oh, is there somebody else? Oh, sorry.
Oh, there's another question over here. It's from Kitty.
Thanks, Olivier. I really enjoyed that. I'm interested in this question of whether of targeted benefits being less resilient to austerity, because that idea that universalism has more support and those benefits will be more protected is something I've always been convinced by in principle and argued that, but when pushed on the evidence, I haven't had very much. And then in practice, when we saw austerity come in, it was interesting. So the UK actually relatively protected benefits for initially, at least for more the targeted benefits, and universalism was cut. We no longer have a universal child benefit, and France did exactly the same thing. So it didn't follow the sort of model that they were protected. So I can see from your slides, I need to look up Jacques 2023A for the evidence. I'll definitely be doing that, but I wondered if you could give it.
Yeah, so that's a piece in social policy and administration that, so I compared the effect of austerity across welfare regimes, and what you see is that, for example, labor market insurance, so basically social policy that is not healthcare, pensions, and, well, not education and etc. So really labor market insurance is more vulnerable within liberal welfare states to austerity, and only in appendix because, you know, I had to cut things. In the appendix, I used the CRCHUM measure of benefit generosity towards different income groups, and countries that have more targeted benefits with the CRCHUM measure, when they implement austerity measures, they are more likely to have that benefits cut back than countries that have more overall generously benefits than others. But indeed, like that goes a bit against the conventional argument. Like Pearson was saying, if you have universal benefits, it's easier to cut because there are more there's more money. But I think it makes sense that programs for the poor are poor programs, and we see it during austerity. I think it works in my models, but you know, it's cross-sectional things, you know, by panel, but with country level. It's not great in terms of stats, but you do what you can with the data.